So Hans, I'm having this patient with leg pain.
Yeah.
What's new in this course about that?
I think over the years, when we were teaching this course, it came to my mind that most of the McKenzie therapists have, I think, two things to really realize. And the first thing is, not every single leg pain starts to centralize. So we have that radicular syndrome. Maybe it's a derangement and it's centralizing, or maybe it's a radicular syndrome without directional preference.
Right.
So that's the one thing we really focus on, when to stop searching for derangement and to go over to a different management for that patient, which is not centralizing. So that's a big part of the course. And the other part is recognizing when a nerve is really inflamed and what to do with it.
Right. And now before we used to say MUR.
Yeah.
But there's something new out, right?
Yeah, so we changed the classification system because I felt like MUR is mechanical unresponsive radicular syndrome. And in a lot of countries where English is not the first language, people had problems with unresponsive. They were not, we meant like it's not responding with a better or with centralization,
right,
but not as unresponsive being no effect, which was often the case. They thought like that. So we were discussing that in the educational committee, and we changed that name to radicular syndrome, and in this case without directional preference, being the old MUR.
Okay, so things are changing, yeah?
Yeah, absolutely.
Okay. And it's not just the lower limb or the leg?
No, it's on the arm symptoms as well. I do little things on the thoracic as well. Thoracic herniations, which are pretty rare to see, of course, so we don't spend a lot of time. And the other thing which we brought in as well is in stenosis, and maybe more important on foraminal stenotic problems, because they sometimes look so much the same as the radicular syndrome without directional preference.
Right. And now this is going to be 2 days in Gothenburg, yeah?
Yes.
Is it going to be any practical sessions as well?
We do a lot of case studies, we do a lot of quizzes, we do a lot of discussions. There are not that many practical techniques like that. We do at the end of the first day, and that are the techniques which I've been using in my practice, which is loaded with all those radicular syndrome patients, which are different from what you normally do during the ABCD course.
So can you give me 3 reasons why I should attend this course in Gothenburg?
First, if you have some problem treating that radicular syndrome, or you are afraid to test them. Secondly, if you want to know what to do if you can't centralize that patient.
Yeah.
So we will go over that. And maybe more important, when to stop searching for that, because I think that's for most people very difficult to say it's not a derangement. And thirdly, what can I do if a nerve is hot? And then fourth, if I may say, we go over the differentiation between stenosis, foraminal stenosis versus radicular syndrome without directional preference.
Excellent. And we don't really have the time to cover that in the other courses. So
no,
it's something out of those courses. Yeah?
And I think the nice part now is that we use material which is just made for the online Part C course. Yeah. So they get a little package on radicular syndrome without directional preference, and on the stenotic part from that course as a sort of pre-prep preparation for this masterclass, so that everybody's on the same track. You already thought about it a bit, so I think that it brings the level of the course a little higher as well.
Great.
Yeah.
So you just taught this in South Africa, and now you're coming to Sweden.
Yeah. South Africa was online, by the way. So it's not that far for me to travel. But it's was a nice experience as well, and I have to say that everywhere in the world we have the same sort of questions. So maybe in Sweden it's a little bit different, but that's no problem. The reason I teach that is because this is my biggest caseload. I'm seeing a lot of radicular syndrome patients, and I'm doing research on that. So
great. Yeah, well, I think we all know your research. So we're looking forward to see you in Gothenburg in October 3rd and 4th this year. Yeah?
I hope to see you all there, because I think it's an interesting course to do, of course.
Great. Thank you, Hans.
Thank you.